Hello, my name is Dr. Edgar da Silva, and this presentation is going to be how to approach calf pain during a NAC OSCE station. This video is for educational purposes only, and it's part of Starmed medical education program. I'm going to start with a quick overview on the exam day during the NAC OSCE examination. All candidates rotate through the same series of stations. Each station is 11 minutes long, with 2 minutes between stations. During your 2 minutes, you have to read the scenario, write your possible differential diagnosis according to the patient's age, gender, and symptoms. After entering the room, sanitize your hands, introduce yourself, and greet the patient. During the interview, always remember to be empathetic, non-judgmental, and patient-centered. If possible, try to use as many open-ended questions as you can. In each station, there is at least one standardized participant and a physician examiner. A brief written statement introduces a clinical problem and outlines your tasks. You may be required to perform one or more of the following: elicit a history, describe a focused physical examination, manage or resolve a patient problem, counsel a patient or a family member, answer oral questions, summarize and present findings to the examiner or colleague, read or reference materials such as charts, test results, medication lists, and summaries. Interact with physicians and other healthcare professionals. If you finish the encounter early, you must wait quietly. If you remember something more, you may re-engage the patient at any time until the 8-minute warning signal for stations with oral questions, or at any time until the final 11-minute signal for stations without oral questions. Here is an example of a clinical scenario. A 38-year-old male comes to the hospital complaining of pain in his left calf. Vital signs are presented as blood pressure 132/78, heart rate is at 80 beats per minute, temperature 37.6 Celsius, and respiratory rate at 14 per minute. Your task is to take a focused history and perform or describe, now during COVID, we're describing focused physical examination. So first thing that you have to think about is your differential diagnosis in calf pain. It could be deep vein thrombosis, cellulitis, rupture of Baker's cyst, ankle sprain or spasm, ruptured calf muscles, peripheral artery disease, popliteal aneurysm, hematoma, Achilles tendinitis, and others that you might remember. And here are some of the fundamental questions that you have to ask the patient. Don't forget, you were asked to have a focused history and physical examination. So history of the presenting illness, remember OCD, PQRST, associated and constitutional symptoms. So ask about onset and duration of the pain, location and radiation of pain, severity, alleviating and aggravating factors. If there's leg swelling, neurological symptoms in the affected limb, association with shortness of breath. If you're thinking about DVT, always remember to ask questions about lungs. Ask about fever, diaphoresis, chest pain, hemoptysis, personal history of clotting disorders, malignancy, diabetes, mellitus, pregnancy history for females, history of immobilization, recent leg trauma, recent long trip, medications, allergies, especially for females, hormone replacement therapy, oral contraceptive pills. Ask about smoking history, family history of thromboembolic diseases like DVT or pulmonary embolism. When you start your physical examination, don't forget to recheck the vitals and the general condition of the patient. Start with inspection. Remember the mnemonic SEEDS. Inspect for swelling, edema, atrophy, deformity, and scars. Inspect for erythema, varicosity, venous ulcers, and joint effusions in the affected limb. Then go to palpation. Remember the mnemonic TTC. That's tenderness, temperature, and crepitation. So palpate affected limb for tenderness, compare both limbs for warmth and crepitation, assess for MRSP, motor, reflex, sensation, and pulse in the affected limb, neurological examination. Measure and compare calf circumference for each limb. Then check the range of motion. Flexion, extension, and rotation of the limb with passive and active movements. And then go for the special physical tests. You might want to perform Homan's sign, which elicits pain, tenderness in the calf of passive dorsiflexion of the ankle, if you're thinking about DVT. You might want to have the ankle brachial index, or to perform a 6-minute walk test for a patient. If you're thinking about fractures, always remember the Ottawa knee and ankle rules. At the end of your station, you might be asked some oral questions regarding a diagnostic workup or management. Remember, investigation and management should reflect your top diagnostic. So you might want to order some tests like laboratory tests, CBC and differential, PTT, INR, D-dimer, cultures, CPK, and myoglobin. You might want a Doppler ultrasound of the legs, or other imaging tests like CT scan, Xray. You might also want a hypercoagulability testing on patients without predisposing conditions, or with recurrent DVT or familial history of DVT. And regarding your management, you might want to ask the patient to rest the limb, have some compressions, elevate the limb. You might want the patient to have some medications like heparin, warfarin, or NOACs, even antibiotics if your diagnosis is an infection. You might also want the patient to have vasodilators or pain medication. And if it's something really urgent, the patient might need surgery or a sprain. So you always have to have those management on the top of your mind and the lab and imaging that you need for testing the patient. And that's all. Good luck on your exam.